Welcome to Michigan Autism Academy's Medication Administration Training, where we train to get it right. My name is Penny Ohia, and I am the Medication Administration Trainer here at the Academy. Today's session will cover the 6 rights of medication administration, so let's get into it. Observing the 6 rights is the required and safest way to administer medication, making it less likely for a medication error to occur. So when you before you administer that medication, you must verify the 6 rights every time. Even if you've passed this medication many times before, and perhaps you might be in a hurry, if you don't check those 6 rights, you could make a mistake, and that can cause a person to get sick or die, and you can lose your job. So never pass a medication unless you are sure you have the right person, the right medication, the right time, the right dose, the right route, and the right documentation. So let's cover the first of the 6 rights, and that is the right person. In order to make sure that you have the right person, you have to positively identify that person. Now, there's 2 types of client identifiers that are required, and you must use at least 2 of the following. The person states their full name, and you compare that name to the medication record, and the person states their date of birth, and you compare it to the medication record, or they have a picture ID or a recent photograph that's attached to the medication administration record. And if a staff knows the individual, the staff can identify the person. Right medication. To ensure that you administer the right medication, you are required to follow the 3 rules, and this is to be checked every time: the prescription, the pharmacy label, and the medication administration record. And the information on those 3 documents must match exactly. Now, if you're not sure about the medication, or if you have any questions about it, don't give the medication. Call your supervisor or the pharmacy or the doctor that prescribed the medication to get some clarification. You want to also double check the generic versus the brand name. Double check pills that are different in appearance, and double check meds with similar names. Right dose. Now, the dosage of a medication is how much of the drug is given. The dose is usually measured in either micrograms, and that's the abbreviation for mcg, milligrams, that's the abbreviation for mg, grams is the abbreviation GM, and milliliters is ML. Now, you can refer back to your abbreviation sheet. It is in your learning management system, and you can download it. Now, by definition, the strength of a medication and the dose of the medication are not the same thing. And when we get into our transcription session, we're going to cover that information as well. The right time. When a physician prescribes a medication, they're going to specify how often that medication can be given. Keep in mind that some medications must be administered only at very specific times of the day. Give that medication as close as possible to the prescribed time, and that's going to ensure that there's a steady therapeutic level of medication in the bloodstream, so that person can get the most benefit from that medication. Anytime medication is not given within a proper time window, contact your supervisor. Follow your employer policies and procedures, and fill out an incident report. Giving a medication at the wrong time is a medication error, and that must be reported. The right route. The way the medication is administered is into the body, and that's called the route. How the medication is taken determines the amount of the medication that reaches the bloodstream and targets the body system or their cells within a specified time. Now, the prescriber's order and the pharmacy label should state the route by which that drug is to be given. If there's nothing stated in an order, give it by mouth. But make sure prior to crushing or opening any medications that there is an order from the physician to do so. Let's talk about some common drug routes, which we've already discussed earlier in our training, but we'll go over some of those routes again. Oral, that's by mouth. Now, oral route is the most convenient and most common route that you will use to give meds. Injectables. In this training, you do not qualify to give medications by injections or perform any procedures that's not covered in this training. Rectal, vaginal, transdermal patch, that's a patch that's put on the skin for systemic absorption. Inhalers or inhalation therapies. Now, for inhalation therapies, you have to have additional training. Again, this training does not qualify you to give medications by injection or perform other procedures not covered. And finally, the right documentation. Remember to always document immediately after administering the medication by initialing the medication administration record. Now, documentation should not be recorded ahead of time or at a later time. The person administering the medication must be the person who documents on the medication record. And failure to document correctly is a medication error. If the medication is not given, then you document by putting a circle in the box where your initial goes. You put a circle in the box on that MAR, and then you fill out an incident report. Perhaps you might have to document on a healthcare chronological, maybe on the back of the medication record. So there's a number of different documents in which you would have to, forms that you would have to document. So follow your agency guidelines, because filling out an incident report, that is a requirement for your job. All right, so this concludes the 6 rights of medication administration training.